everybody, Dr. Daniel. And today I'm speaking about how does migraine aggravate photophobia. We know that patients with migraine have light sensitivity, but how does that happen? Part of the reason is because migraine turns on and inflames all the senses in the head, such as smell, which is olfaction, or hearing, which is otic type of influences. So loud noises will bother patients with migraine. And then light, flickering lights, or bright sunlight will aggravate migraine patients who are sensitive to these features. So the question is, how does migraine aggravate photophobia? That migraine aggravates light sensitivity is true, but the way it does it is still uncertain. Photophobia may result from photic activation of retina-driven pathways in an extremely complicated but not completely understood fashion. So what is the pathophysiology of migraine? Well, this is really not well understood at this time. Migraine has something to do with light processing and sensitivity, and it also relates to olfaction and auditory features as well. And migraine patients are found to be generally more sensitive to light even when they don't have a headache. So they wear dark glasses, they avoid the beach or going out in sunlight more than normal persons, even though they're not having an attack of migraine. There was an article reported by et al. In Cephalalgia on interictal photosensitivity and altered brain structure patients with migraine, in that they had more well-developed right parietal occipital brain thickness and left frontal parietal region thickness, suggesting that persistent light sensitivity is associated with underlying structural changes. Again, we know this is true, but we don't really understand why it happens. Well, what are the causes of photophobia? Blepharospasm is another cause of photophobia. It's found with photophobia. It's an abnormal spasm causing your eyelids to blink, a sudden closure of the eyelids. And light sensitivity occurs with blepharospasm, just like it does with migraine, but it can come and be disabling. So that migraine and blepharospasm are the two most common causes of photophobia. There are other ocular causes of photophobia, and those are dry eyes, iritis, uveitis, keratitis, conjunctivitis, cataracts, ocular irritation, such as produced by traumatic scratch or blow to the eye, corneal neuropathy, corneal abrasion, cone dystrophies, retinitis pigmentosa, congenital glaucoma, or inherited degenerative retinal diseases. There are also central nervous system disorders that are found with photophobia, such as subarachnoid hemorrhage due to a rupture of an aneurysm, viral or bacterial meningitis, and pituitary tumors. And then functional disorders, persons with underlying depression, anxiety, panic disorder, bipolar disorder, patients have more blepharospasm and more photosensitivity. There's also some involvement of the trigeminal nerve with this situation, the fifth cranial nerve. And so that goes back to the migraine timing cycle, what happens with migraine in the brain. The first part of the migraine timing cycle, which has 4 steps to it, is the turning on inflammation of the trigeminal nerve fibers, which go around the eye, the back of the eye. And the trigeminal fibers lie at the level of the pons in the brainstem as 3 branches go to the forehead, the cheeks, and the jaw. If you go to my online website, www.drmigraine.com, there's a picture of a lady, and she's holding her right eye and pain in her eye. So pain in one eye is a really cardinal, almost diagnostic feature of migraine. Another question would be, is the retina involved with migraine and producing pain? Again, this is uncertain, but the way it works is light comes into the pupil, goes through the lens, and goes to the back of the eye. And then it goes to the optic nerves, to the occipital cortex, to the back of the brain. There are also some branches that go to melanopsin cells, which are in the retina, that can perceive light but don't really have to function with vision that well. And these may have a connection with the thalamus, providing some kind of input for the pain fibers. Again, this is not well understood. An odd thing here is that persons who are blind with migraine still have pain in the eye. And so it's not coming necessarily from optic or visual features. Okay, well, how would you treat philophobia? Well, the first idea, if it comes with migraine, you want to treat migraine early and quickly as you can. You treat it at the onset. So if a headache starts at 8 o'clock in the morning, you take your triptan at that time and treat the headache. And triptans 80% of the time will take care of migraine within a couple of hours. That's true in about 80% of patients. The other things people can do to help this is wear dark glasses. And so the problem with that is you don't want to wear them too much because then your eyes don't adjust to the light. But it seems that blocking the red and the blue portions of the light is helpful for treating migraine. Some persons there can wear red filtered glasses that block out the blue fibers. There were some studies done at King's College Hospital in London about that feature. Another question is, should migraine patients completely avoid light? Would that help them or hinder them? Well, if you completely avoid light and stay in the dark all the time or inside and you wear dark glasses, your eyes won't become adjusted to the light much at all, and then you can't go out and do anything. So you have to stay in the light to some degree. But migraine patients being so sensitive to light, particularly to flickering light, like fluorescent light bulbs, can be a real problem. And through the years, I've written prescriptions for patients, for their bosses, who work in light environments that bother them, such as flickering light, bright sunlight streaming through the window, and things like that. A patient told me years ago that she was driving a car and she turned to the side and saw glaring light coming through a picket fence, and that started her migraine headache, that very event. So does avoiding aggravating light sources help? Well, yeah, it can if you get out of the way of these fluorescent lights and all. Also, the amount of light that comes out of a light bulb matters, and so if they're not so bright, that'll help. And it's found that persons with migraine with photophobia have more sensitivity to light at lower levels than normal people do. All right, so I understand all that, but is migraine a frequent problem? Well, you better believe it. For women, migraine is the most common medical problem they have, more common than diabetes, hypertension, arthritis. Something like 26% of world population women have migraine. It's like 6% of men have it. Migraine is considered to be a disabling condition. It's a frequent reason to go to the emergency room. So dealing with light in this sort of context is very important because it's one of the aggravating features. The other thing is tension type headache doesn't have by definition sensitivity to light, but only migraine does. So in a history from a patient, you hear them being sensitive to light, that's thinking with the doctor's point of view that that's probably a migraine headache. I hope it's been helpful for you to associate in the problems with photosensitivity and light. Sorry, we don't know how to interact, some of the mechanism for the pathophysiology. That's just the state of the art now. And we need to do more studies to look at that. So thank you for watching this. Please click like and subscribe down there. Follow me on YouTube for other articles that I have on migraine. God bless all you persons with migraine, in particular those with light sensitivity. And I will see you all on the next talk.